Hey guys, Szenan-Balance from ACC School. In this video, I'm going to share with you if you are injured acupuncturist. I'm going to share my clinic, how we treat private patient, and what technique do we use, and how many patients do we see in an hour, and how many patients do we see in a day. Okay. Also, I want to share with you, I don't see any ACC patient, and then how do you actually turn ACC patient to private patient? If you want to know all about this, and this is the video I want to share with you. First, let's have a look today. My ACC patient in my clinic, not my colleague, how many patients do they treat ACC patient, and do they actually treat private patient or not? All right, let's have a look on our calendar. Well, today is Tuesday, right? 18th. As you can see, I started 11:30 and finished about 4:30. Okay, and I have 2 patients, cancel the appointment. Otherwise, I have 19 patient, and this is a very good example over here from 1 o'clock. So I book my patient every 15 minutes, 1:15, 1:30, 1:45, 2 o'clock, 2:15, right? 2:30, 2:45, 3 o'clock, 3:15, something like 3:15, 3:30, 3:45, so 3:35, and 4 o'clock, 4:15. You see over here, this is all private patient. Okay, look at my colleague one over here. This color ACC patient, in a whole day for 10:30 to 7, only 5 ACC patient, and all of them, this color and this color, all private patient. That is 14 patient. In my others, this is pretty new, within 6 months, right? Probably about 6 months, new practitioner. He's seeing 8 patients, an ACC patient, AC2 private patient, and all this ACC patient only half an hour crossover. You see, they see more patient, 8 patient, not a full day, just half day. As you can see that I see about 4 patients an hour, right? So I can see up to 8 patients an hour, right? This is my record, but we're comfortably seeing 4 patients an hour. And because we have 7 beds in the clinic, I have to share with others, so I don't see as many as I wanted to. But I can comfortably see 4 patients or up to 6 patients an hour. Okay. The thing is, most of you, I believe there are more people, more acupuncturists, some acupuncturists in New Zealand that seeing this number of patients, right? Or even more. Okay. In Taiwan, my student, they see patient in 4 hours, they see 50 to 60. Right? If they see 60 patients, they treat 60 patients, which means every 5 minutes they see 1 patient. And my students share with me, ever since they learn balance method acupuncture, and my way of balance method acupuncture a bit different, called a modified, so they double the amount of the patient. Okay, so if you want to see more patient, first you need to have a very effective technique and quick technique. Okay, you don't stuck there. Okay, and I don't do massage, to be honest. Okay. Second, I used to see ACC patient, but I don't see any ACC patient anymore. And we do surcharge. Our ACC surcharge is $45 for my colleague. I used to do $80 surcharge. Okay. So I cross over all the ACC patient, right? Before COVID. And after COVID, I don't see any ACC patient anymore. I only see private patient. And all my private patient, I cross over. You see? So I see about 17. So 2 of them canceled the appointment. I still have 17. Otherwise, I have 19. Right? Otherwise, I have 19. Sometime in 4 hours, I see 25 patients or 22 patients. This is very common for me, so I want to share with you. You can do that too. You can do that too. I believe everyone can do it. It's about the mindset. How do you do that? You know, I believe all the acupuncturists can do that. I share with my practitioner. I told them, if I can do it, you can do it. Because if you learn my technique, you'll be able to do that. Okay. This is what I want to share with you. And if you want to learn my technique, okay, to see, short amount of time to see a lot of patients, then better to attend my workshop in September in Hamilton. Okay. And then I will give you a bonus to share with New Zealand acupuncturists. How do you turn your ACC patient to private patient? Okay, for example, your ACC patient comes with back pain, they have diabetes, they have high blood pressure, they have insomnia. All they need herbs, right? Herbs, insomnia, high blood pressure, diabetes, digestive problem, all those things are private patient cases. And how do you talk to your patient to convince them to pay out of their own pocket to treat all this problem? I have a script. I can show you how to do that. And then how do you ask your patient, your current patient, whether it's ACC or private patient, to refer you more patient? This is the key. I get more patient, okay, for free. And then how do you do marketing, advertising to get more new patient? We have a way I would like to share with you if you attend my workshop. And this message is all for free, a bonus in my workshop. Okay. Well, thank you for watching this video. And I believe if you watch till now and you want to see more patient, right? And I can show you because I've been there. I used to just see ACC patient and now I see only private patient. And look, if you're just treating ACC patient, you compete with a lot of people. Chiropractor, osteopath, physiotherapists, massage therapists, and all your colleague acupuncturists. If you're treating insomnia, if you're treating diabetes, high blood pressure, digestive problem, heart problem, cancer, hey, chiropractor is not gonna do this type of treatment for their patient. Osteopath, they're not doing that. Physiotherapy, they're not doing this. Massage therapies, they're not doing this. Acupuncturists, few of them doing this, but most of them, they don't do this. So who do you want to be? How many patients do you want to see? So that I share my story with you and encourage you to see more patients, encourage you that believe in acupuncture and Chinese medicine, because we can help more people, right? So if you want to join my workshop, please contact me and would like to see you. I would love to see you in my workshop. I'll see you next time. Bye-bye.